Hi, I'm Sarah. I'm going to be doing my blood administration video. Before I go into the patient's room now, I want to just make sure I have some of my supplies ready. So for blood transfusion, we are going to need some wide tubing for the blood. We need a bag of normal saline. Normal saline is the only thing that can infuse the blood. I have a saline flush in case I need it. I have my gloves, some alcohol wipes. I have the signed consent form that the patient Betty has signed to receive the blood, and I have hand sanitizer. So now I'm going to go into my patient's room. I'm going to sanitize. Hi there, Betty. My name is Sarah. I'm going to be your student nurse today. I'm going to go ahead and provide for privacy. So, Betty, do you want to go ahead and just verify your name and date of birth for me, please? And she's going to tell me Betty Jones, 5/21 of 1952. Okay, Betty, it looks like you have a chart, or you have a chart. You have an order in your chart for a blood transfusion. I should also verbalize that I'm going to check my chart before I walk into the room to give blood because I need an order for the blood. So it looks like you have an order to receive some blood. Have you ever received blood before?
Yes.
Okay. Did you have a reaction at all?
No.
Okay. So I do want to take into considerations the fluid status of the patient, if they've had a reaction before to a transfusion, and anything else that would alter my plan of care for the patient. So because you've had a transfusion before and you had no reactions, that should be good for right now. Do you have any allergies I should know about? Any allergies at all?
No.
Okay, perfect. I'm also going to assess with Betty if she can follow simple commands, something as simple as scooting up in bed, moving her arm, anything to know that she understands what I'm telling her and she can follow directions. So once I verify all that, what I'm going to do is I want to verify that her IV is still patent. So it looks like she has a 20 gauge IV in her antecubital. I'm checking to make sure that it infuses, it flushes easily, or anything per agency protocol, how they would check for that. I'm also checking to make sure that there's no redness, irritation, there's no bubbling up anywhere, and as long as IV is still patent, that's what we can use. And after I do that, what I'm going to do then is I'm going to assess Betty. So I'm going to do an assessment on her. I want to know what her lung sounds are, her blood pressure, her temperature, pulse, respirations, blood oxygen level. I want to do all of these assessment things before I give the blood, and I want to do it within 15 minutes of starting the blood, so I know what the baseline is. So Betty, I'm going to go ahead and I think the nurse is almost here with the bag of blood, and we're going to verify all of that. But what I need you to know before we start transfusing you is some of the things to look out for that are abnormal. So if you start to have any shortness of breath, any chest pain, you have any pain in your lower back, you feel like you have chills, a headache, anything abnormal, I want to know about, okay? And if Betty were to have a transfusion reaction in any way, what I'm going to immediately do is I'm going to stop the transfusion. I'm going to remove all the tubing. So I'll stop the blood, remove all the tubing. I'm going to set this aside because I want to send that to blood bank with the tubing. And I'm going to grab a new bag of saline and new tubing, and I'm going to connect that to Betty and run it at the same rate she was receiving the blood. So that's what I would do if a transfusion reaction were to occur. I want to stop immediately. So I did my assessment, and now I'm just going to go ahead and verify the blood with another nurse, and then we will get you started, okay, Betty? So, and Betty, I do already have a signed consent form for you to receive this blood, so I would make note of that. All right, and I have the bag of blood, and I want to transfuse this within 30 minutes of receiving this from blood bank. Okay, so medical record number is 224466.
Medical record number 224466.
The location is HLRL.
Location HLRL.
The account number is 123 1234556.
Account number 123456.
Patient name is Betty Jones,
Patient name Betty Jones.
and I want to verify that the patient name matches what's on the armband. It does. I also want to verify the red armband number, which is 456654.
Red armband number 456654.
The patient has B positive blood type.
Patient blood type B positive.
The donor pool number is 7890.
Donor pool number 7890.
The units in the pool are 4.
Units in pool 4.
The volume is 250 mLs.
Volume 250 mLs.
The blood component is packed red blood cells.
Blood component packed red blood cells.
The expiration date is 12/17/23 at 1500.
Expiration date 12/17/2023, 1500.
And the donor blood type is O positive.
Donor blood type O positive.
Compatibility testing has been completed.
Compatibility testing completed.
The date was 12/17/23.
Date 12/17/2023.
The accession number 1.
Accession number 1.
And that's what I need to know. Before I even hang this and give this to her, what I want to do is I want to verify that this blood is not an abnormal color, that there's no visible clots, anything like that. And before I would go ahead and prime it, I would go ahead and just agitate it to make sure that everything kind of gets mixed together. Before I hang the blood though, I want to get my tubing primed. So I verified this with another nurse. I need my hand sanitizer. I'm gonna put on some gloves. Okay, I'm gonna take my Y tubing, and when I take my Y tubing out, I want to make sure that everything is clamped. I want to make sure that these two are clamped right away and that my roller ball is clamped, and it is. Okay, so I'm just gonna go ahead and hang this up so I don't drop it anywhere. Okay, and now I'm going to grab my bag of normal saline, throw that in the garbage. That also goes in the garbage. I'm gonna spike this bag. And then I want to fill up this filter, this little chamber. I want to fill up this chamber. I might help if I can open that. I want to fill up this chamber so that the saline is covering the top of the filter that's in this chamber. And once I make sure that the saline is up above the filter, I know I'm good. And then after I complete that, I want to take the rest of this tubing and I want to prime it. So I'm going to go ahead and open my roller ball. I'm going to make sure that I get all the air bubbles out and that this is primed. Okay, this is primed. So now I'm going to get my blood hooked up. Okay, so with the blood, I'm going to agitate this bag before I hang it. So once that's all agitated, and I already inspected it. Again, I'm doing all of this within a time frame. So I throw that in the garbage, and then what I want to do is I want to make sure I clamp this bag right here. This has to be clamped. And then I'm going to make sure my roller ball is still clamped, and it is. Spike this bag. Okay. So I'm gonna open this one up, and what I want is I want to see that the blood starts to come down here. I want to see it enter this chamber, and then once I see it in this chamber and I see the blood start coming down this tubing, once I get the blood all the way down, which is going to be hard to tell with the used tubing, but once I get the blood all the way down to here, what I'm going to want to do is stop it because I do not want to waste any blood. So I'm going to stop it and make sure everything's locked, and then I'm going to go ahead and put this within the pump. So alright, so I have this within the pump, and then now I'm going to go ahead and take my alcohol pad. This is gonna beep. Okay, Betty, you might just hear a beeping for a couple seconds, and I'm gonna get you hooked up, okay? So I am going to go ahead and clean the top of this with an alcohol wipe for about 15 to 30 seconds. Sorry about the beeping, Betty. I'll get that turned off in a second, okay? Or per agency protocol. So I'm gonna throw it in the garbage. Okay, so I'm gonna go ahead and okay, so now I'm just gonna go ahead and get this all set up. I take off my gloves and hand sanitize. Something in my eyeball. Okay. So I'm just gonna go ahead and program the pump. So, channel select. I have guardrails, IV fluids. I'm gonna go down to the second page, and I'm giving red blood cells. So I'm gonna go ahead and do that. Red blood cells was selected. Is this correct? Yes. So rate, when I'm infusing blood for the first 15 minutes, I'm gonna do between 50 to 100 mLs per agency policy. We're just gonna do 50. Now I would change this depending on the patient. So rate is 50 mLs per hour. The blind to be infused, that is a 250 ml bag. Okay, and then this is gonna honk at me because, okay, and then restart. It's just gonna say it's included, so I'm gonna restart it. Okay, Betty, I'm gonna mark down the time of the transfusion starting, so 15:48. What I'm gonna go and do, Betty, is I'm gonna sit in here with you for the next 15 minutes. I'm gonna be reassessing. I wanna make sure that your baseline doesn't change and any of those symptoms that we talked about. Oh, and you know what? I'm also still, no, I'm included right here. Open right here. Oh, am I sitting left? Okay. I wanna restart that. Okay. So I just wanna know about any of those transfusion reactions. So after the 15 minutes are up from me starting the transfusion, then I'm just gonna go ahead and as long as everything is okay, there's no reaction, there's nothing like that, I'm gonna tell Betty, I'm gonna be checking on you every 15 to 30 minutes. And once the blood transfusion is complete, what I would want to do then, after the blood bag is done, I wanna make sure that I run the rest of the line with the normal saline that's hanging, and I just wanna run it at the same rate that I gave the blood at. And then once that is completed, what I will do then is take care of all my blood tubing, take everything, throw it away in the appropriate bin, and then I'm going to document. I'm going to document what time I started my transfusion. I'm going to document that I gave this within a 20 gauge needle. It's important to know what gauge needle you have, or gauge catheter. You can only infuse blood between 18, I shouldn't say only. What's recommended is between 18 to 22 gauge. Obviously the larger gauge the better for blood transfusions. I just want to make any considerations if my patient is like a small child, whether it means getting hands to help to kind of get this process, a parent to kind of help, anything to kind of change, make this process easier. And like I said, I'm going to document where my IV is, what gauge I'm using, what time I started. I'm going to document my assessment and everything like that. Before I leave Betty, once transfusion is done, I'm going to make sure her bed's lowered down to the ground. She has her bed rails up. She has her call light. There's no obstacles in her way. The table is up by her. I'm going to tell Betty I'll be back later. I'm going to sanitize before I leave the room. And that is all.